Hello, welcome to my channel. Uh, Today we are doing an OSCE for human anatomy and physiology. So, again, we are going to concentrate on the things we have covered. Okay, so let's start. So, station 1. With the aid of the label diagram of the nephron. So, we have to explain the three processes of urine formation. So that's like 13 marks. So we have to explain the three processes of urine formation, 13 marks, as well as a label diagram of the nephron. Okay, so in terms of the nephron, this is the best nephron I usually like to ask about. So I'll just mention some of the parts. H, so meaning you when labeling, you have to actually put the correct things. So I just use this because it's one I usually like to ask. So H, these are peritubular capillaries. Then E, that's the loop of Henle. Then F, that is the descending loop of Henle. Then G, that is the ascending loop of Henle. Then I, that's the collecting duct. L, I mean. Then I is the distal convoluted tubule. Then D, that is the proximal convoluted tubule. Then C, this is an afferent arterial. Then this is an efferent arterial. So C afferent, B efferent. So the reason why I remember them is the one that is going in first is afferent, then that is going outside, that is the efferent. Okay, then K, that is the, so this is an artery, of course, so this will be a branch of the renal arterial. Then that is the renal. Then J, that's the renal vein. Okay, so these are some of the things you have to know about the structure. So meaning you when labeling, you even have to actually at least label something similar to this. Okay. Okay, so let's continue. So the other question was to explain the three processes of urine formation. So number one process is the glomerular filtration. So under glomerular filtration, there of course is blood that's passing through the glomerulus, and that blood actually is going to be filtered. So meaning blood is going to be filtered, and molecules and ions and other electrolytes. So in short, we're talking about glucose and electrolytes, and other electrolytes such as sodium and even water is also going to be filtered through the Bowman's through the glomerulus. Okay, so that's what happens. So anything smaller than the proteins is going to be filtered inside the distal convoluted tubule, or into the tubules. Okay, then after those things were filtered, the next step is tubular reabsorption. So since you remember we mentioned about glucose is still an essential molecule that is needed by the body. Okay, unless maybe it has gone beyond the glucose renal threshold, then of course it's going to be excreted. But if it hasn't, then it has to be reabsorbed back into blood. So under tubular reabsorption, so we'll talk about important molecules that were filtered but are actually essential. So meaning glucose is one of them, and most of the times even water also sometimes. Most of the times, you find that water that was filtered needs to go back into the circulation, so that at least the patient probably does not go into uh, hypovolemia or then become dehydrated. Okay, so meaning under tubular reabsorption, we talk about reabsorption of important molecules as glucose, ions, even water. Okay, then under tubular secretion, so there are some molecules which does not necessarily pass through the glomerulus, so these ones need to be secreted directly into the convoluted tubule. So molecules such as the hydrogen ion, so especially maybe for maybe someone is having acidosis, to find that that acidosis is going to trigger a tubular secretion of hydrogen ions inside the convoluted tuber, or even just normally, in order to maintain the acid-base balance, the body also make sure the hydrogen ions are being secreted inside the convoluted tuber. So tubular secretion is about secreting or adding molecules that were, or ions that were not filtered, So meaning these ones are just added into the convoluted tuber. So that's the three processes of urine formation. Then after the tubular secretion, whatever is going to remain will go into the collecting duct, and that will be your urine. Okay, hope at least you have heard something about this. Okay, next station. Next station, describe the chemical digestion of carbohydrates. Okay, so here comes the answer. So chemical digestion of carbohydrates is, of course, the breakdown of complex carbohydrates into simpler sugars, which can be absorbed and utilized by the body. The number one process under chemical digestion. So of course, before chemical digestion begins, someone of course needs to consume the carbohydrates. So number one process is the ingestion. So carbohydrates are consumed through food. The next is the mechanical breakdown, where the teeth chew food into smaller pieces. Then next is now, when after the food has been broken down into smaller pieces, then saliva amylase will petlin enzyme, which is found in saliva, breaks down starch into maltose and dextrins. So now that's chemical digestion. Now that's what we're talking about. Okay. Then after the salivary amylase has acted on the starch, of course, food has to pass through the esophagus and go into the stomach. Okay. Then into the stomach, there is gastric digestion, but in terms of chemical digestion, there is none. Okay, because in terms of chemical digestion of carbohydrates, there is none. Because gastric digestion primarily digests proteins. Then after the stomach, then you are going to find the small intestines. So specifically in the duodenum, there is going to be a pancreatic amylase. So pancreatic juice enzyme breaks down starches, glycogen, and dextrins into maltose, maltodextrins, and limit dextrins. That is pancreatic amylase. Okay, that's one thing you also have to know in terms of digestion of carbohydrates. Then, in terms of continuation from the pancreatic amylase, the bound part is the small intestine. I think I mentioned this area on the pancreatic amylase. So into the small intestine, pancreatic amylase such as amylase, glucosidase, further break down carbohydrates. Then in the brush borders, and also there are some brush border enzymes such as maltase, sucrase, and lactase. So these ones further break down carbohydrates, and this one further break down disaccharides into monosaccharides. Then of course, after all this digestion have taken place, then finally we are going to have absorption, where the simple sugars such as glucose, fructose, galactose are absorbed into the bloodstream. Okay. Okay, so that's the end of the next station is draw a well-labeled diagram of the growth structure of the kidney and write down 5 functions of the kidney. Okay, so in terms of the growth structure of the kidney, this is the growth structure of the kidney. So we have the capsule, the renal capsule, this is the renal capsule. Then you have the renal cortex, this is the renal cortex. Then you have the renal medulla. Then inside the renal medulla, the renal medulla is where the pyramids are. These are pyramids. Then the tip of the pyramids is called the papilla. So that's the papilla. Okay. Then below the papilla, you have the minor calyx. Then the minor calyx drops into the major calyces. or the major calyx. And the major calyx will find itself into the pelvis. And pelvis, you have the ureter. Okay. Then this is the renal artery, and this is the renal vein. Okay, that's the gross structure of the kidney. Then in terms of functions of the kidney, number one, we have fluid balance, we have electrolyte balance, we have waste removal, we have acid-base balance, you have blood pressure regulation, you also have stimulation of red blood cell production, then finally vitamin D activation. Of course, these are not 5, these are 7, but the question was 5, so I wanted to add more than 5 so that at least if you are to forget some of the other things, at least you can use these for you can add more answers. Okay, at least if you add more answers, it's going to be easier for you to remember at least 5, because if you just know 5, then the possibility of you forgetting 2 or 1 is high. Okay, but if you know more than 7, then at least you are safe. Okay, that's station 3. Then station 4, the organs of the female reproductive system produce and maintain the female sex cells or egg cells. Then question 1 is saying draw a well-labeled diagram of the internal organs of the female reproductive system. That's about 10 marks. Then B, state 5 functions of the female reproductive system. Then describe the female reproductive cycle, the menstrual cycle. Okay, so for this one, the answers. So if they tell you to describe the internal one, this is what you have to draw. Okay, from the vagina, the cervix, then the uterus, and the fundus of the uterus, then the fallopian tube. Okay, then you have the ovaries, you have the round ligament, you have the ovarian ligament here. So this is ovarian ligament. Then you have the broad ligament here. Okay, so those are some of the things. This is the internal female reproductive system. Okay, then 5 functions of the female reproductive system. Number 1, we have oogenesis. So oogenesis is, of course, the production of the egg cells, the ovum. Okay, the number 2 function is support of fertilization and implantation. Then 3, maintenance of pregnancy, childbirth and labor, production of hormones like estrogen and progesterone. Then 6, protection against infections. So we have natural barriers, which like the cervix and the vagina. So these are structures which act as natural barriers. Then 7, you have regulation of the menstrual cycle. And most of the things which I have noticed is that no matter how many times I ask this question, you find that there will always be students who put function of the female reproductive as in for it allows penetration of the penis or for sexual intercourse and whatnot, but that's not a function of the female reproductive system. Okay, the function is for this maintenance of pregnancy, childbirth and labor, fertilization. That's a function. Sex alone is not a function of the female reproductive system. That is for procreation. So these are the functions we are talking about for reproduction in short: fertilization, implantation, pregnancy, childbirth, labor. Those are the functions. Okay, then the other question was describe the normal menstrual cycle. So for this one, I'm not going to I'm just going to describe it. Okay, so you just have to pay attention. Okay, so menstrual cycle, in terms of, at least I'm going to start with a definition. So I'm going to say the menstrual cycle is the normal menstrual cycle is a cyclical uterine bleeding which occurs in women of reproductive age. Okay, then second, I'll talk about the anatomy, or where I'm talking about the phases. So there are 2 phases of the normal menstrual cycle. You have the follicular phase and the luteal phase. Okay, then inside the follicular phase, I'm going to say the follicular phase overlaps with the menstrual phase, or the menstrual phase occurs from 1 to 5 days of the 14 days of the follicular phase. So in short, follicular phase is about 0 to 14 days, and 5 of those days are menstrual days. So meaning those are active menstrual period. Okay, those are 5 days of that of those of the follicular phase. Okay, so meaning if you find a book which is saying you have the menstrual phase, so meaning the menstrual phase inside the follicular phase, but just the 5 days alone. Okay, so after you have established the 5 days that they are active menstruation, someone will be bleeding. Okay, so what will happen again in the follicular phase is that there's going to be stimulation of the, or there's going to be release of the gonadotropin releasing hormone from the hypothalamus, so that the gonadotropin releasing hormone will go and stimulate the anterior pituitary gland so that it secretes two hormones, luteinizing hormone and the follicle stimulating hormone. So after the follicle stimulating hormone has been secreted, of course, going to stimulate the ovaries now to start producing the follicles. Okay, specifically it's going to induce about 15 to 20, and only one is going to mature into a dominant follicle, which we call the Graafian follicle. Okay, then apart from that, then of course estrogen at this stage will start being produced. Of course. So that's the other function of production of hormones like estrogen. Okay, so at this stage estrogen will start being produced. Okay, so as the follicular stage is going on, remember we said there is also production of luteinizing hormone, but in small quantities. So on the day 14th, you find that there's going to be a surge of luteinizing hormone, and that surge of luteinizing hormone will bring about ovulation. So on the 14th is going to be ovulation, which comes in due to a surge of luteinizing hormone. Okay, then if again you wanted to separate the follicular phase and the ovulatory phase, that's how you can do it still. But otherwise, if you explain like I have explained it, you are all well and good. So otherwise, that's the end of the follicular phase. It ends after ovulation, or it ends on the day of ovulation. Then that's the way it ends, and the egg survives for 24 hours. Okay, so then day 15 up to day 28, if you are using a normal menstrual cycle, or which is an average of 28 days, then day 15 up to 28, that is the luteal phase. Then inside the luteal phase, remember ovulation has happened. Okay, so what's going to happen inside the luteal phase are two things. So either the egg which was released will be fertilized. Then if it is fertilized, then of course someone will be pregnant, and the embryo will start producing what we call the human gonadotropin, the human chorionic gonadotropin, meaning the HCG. So that hormone, human gonadotropin releasing hormone, is going to be produced. Okay, and where the egg ruptured from, meaning where the ovum ruptured from, with that structure we call it the corpus luteum. Then the corpus luteum will be producing progesterone. So at least now you have understood now the production of hormones such as estrogen and progesterone. So the corpus luteum is a structure which remains after now the ovary has ruptured, and that structure which remains is the corpus luteum. Corpus luteum produces progesterone. Then progesterone is a hormone of pregnancy. Okay, so those are the things. So then the one which maintains the corpus luteum during pregnancy is the human chorionic gonadotropin. Okay, so meaning the corpus luteum, if someone is pregnant, will continue to produce progesterone up to 4 months. Why 4 months? Because by then we expect the placenta to have matured enough, and we expect the placenta to be producing adequate progesterone. So in anatomy and physiology, one thing you have to know is you have to use the correct terminologies. So meaning by the month of the 4th month, we expect the placenta to be now producing adequate progesterone. So after the 4th month, the corpus luteum degrades, in short. Okay, so I've explained what happens if someone is pregnant, or if someone was to fall pregnant. We are saying after the ovary the follicle ruptures, and it leaves what we call a corpus luteum. corpus luteum start to produce progesterone. Progesterone is a hormone of pregnancy. Okay, it's one that maintains pregnancy. Okay, and then after someone, of course, the embryo will start producing HCG, which is the human chorionic gonadotrophin. Then it's going to maintain the corpus luteum for up to 4 months, because by then we expect the placenta to be releasing adequate progesterone. Then after that, then the corpus luteum will start degrading now, since it's no longer needed. Okay, so those are some things which happens if someone is pregnant in the luteal phase. But if someone is not pregnant, what's going to happen is that since the corpus luteum will still be producing progesterone, if someone is not pregnant, it's going to degrade after 9 days. After 9 days, it's going to degrade into the corpus albicans, then finally degrade. So meaning progesterone is stop being produced by then. Okay, but estrogen is throughout. Okay, then after that, then you are going to wait until you are reaching the end of the cycle. So after a cycle ends without fertilization, then there's going to be shedding of the functional layer of the endometrium, and it will now go back again to the follicular phase, specifically the menstrual phase of the follicular phase. Those average of 5 days of bleeding, those ones come about after the 28 days if someone was not pregnant. So that's the normal menstrual cycle. Otherwise, that's how you explain it. Okay, so let's make progress. Session 5. So draw a well-labeled, so don't draw of. Draw a well-labeled diagram of the growth structure of the skin layers or the integumentary system, and write down 5 functions of the skin. Okay, so this is the structure of the skin. They have the epidermis, the dermis, the subcutaneous. You have the sweat gland, the pasina, capsule, the cutaneous nail, the hair root, the follicles, the hair follicle, the erector pillar muscle. These ones. They have the sebaceous gland. You have Meissner capsule. You have the dermopapillae. Okay. So those are some of the things. Okay. Then in terms of function of the skin, number 1 is protection. So the skin acts as a barrier against external factors like temperature, humidity, and physical damage. Then the other function is the regulation of the body temperature, or thermoregulation. Then the other ones is the sensation and perception, your production of vitamin D, you have excretion and waste removal, the fluid balance maintenance, as well as immune function. So the skin acts as an immune organ, providing a physical barrier against pathogens. So it's supposed to be providing here. Okay. So that's the functions of the skin. Okay, so let's make progress. Session 6. Outline the hormonal control mechanisms, the negative and positive feedback. So also give examples in your explanation. So meaning, as you are explaining the negative and positive feedback, at least you give an example of a negative and of course a positive feedback. Okay, so positive feedback, this is when the effector of a process boosts the stimuli, which increases production of the product. Example would be when a female is giving birth, oxytocin is released causing contractions. That's positive feedback. The negative feedback, we have the effector of a process, reducing the effects of the stimulus, which in turn decreases production of the product. For instance, when a person is feeling cold, the hypothalamus triggers shivering of the body so as to generate heat for the body. So that's what happens during the positive and negative feedback and the examples. Okay. Then session 7. Write down the phases of wound healing, local factors that affect wound healing, systemic factors that also affect wound healing. Okay. So in terms of the phases that affect the phases of wound healing, we have the mnemonic HIPR. These are the phases of wound healing. So H stands for hemostasis, I for inflammatory process, then P proliferative, then R for remodeling. So these are the phases of wound healing: hemostasis, inflammation, proliferation, remodeling. So remodeling is also known as maturation. Okay, then for the factors that affect wound healing, they said local factors and general factors. So local factors, we talk about near the site. So if there is infection at the site, then of course someone is going to have poor wound healing. Then we have the presence of necrotic tissue and foreign body, poor blood supply, venous or lymph stasis, tissue tension, hematoma, large defect or poor apposition, recurrent trauma, X-ray irradiated area, site of the wound, for instance, wound over the joints and the back has poor healing. You have underlying diseases such as osteomyelitis and malignancy. You have mechanism and type of wound such as incised or lacerated or crushed or avulsion wounds. These ones also have a problem during healing. Okay, so these are local factors that have to do with at the site or near the site. Then you have general factors now. Number one is age. Age, of course, the more elderly someone is, the more wound healing is going to be slow. So meaning in children, wound healing is actually fast, or they heal at a faster rate as compared to adults. Then the other factor is obesity. Obesity negatively affects wound healing. Smoking negatively affects wound healing. Malnutrition negatively affects wound healing. Vitamin deficiency. So vitamin deficiency, specifically vitamin C, is one of the culprits. Then anemia also, and I remember most people put anemia under local factors. So under local factors, just put the poor blood supply, because anemia is systemic. So in short, instead of calling them general factors, you can also call them systemic factors. So these are systemic factors that these affect the system. Okay, so anemia, malignancy, uremia, jaundice, diabetes, metabolic diseases, HIV and immunosuppressive diseases, steroids and cytotoxic drugs, and you have neuropathies of different causes. So these are some of the factors that affect wound healing. Okay, so that's all on session 8. Draw a well-labeled diagram of the digestive tract, meaning you have to label the mouth, tongue, esophagus, stomach, duodenum, ileum, colon, sigmoid. Okay, in short, we are talking about the integumentary system through and through. Okay, then also draw a well-labeled diagram of the tooth. Describe the physiology of defecation. So this is the structure when we talk about the digestive tract. So we have the mouth. From the mouth, you have the pharynx. Okay, you have the esophagus, you have the stomach, you have the pancreas, you have the small intestines, the large intestines, the anus, the rectum, the liver. This is the gallbladder. Then these are salivary glands. Okay, that's now the digestive tract. Then in terms of describing the physical, describe the physiology of defecation. So step number 1 is feeding of the rectum. So the rectum stores feces from the colon as the rectum fills. Then it stretches, then the stretch receptors in the rectum wall, in the rectal wall, are activated. Then step 2, during activation of the defecation reflex. So the stretch receptors send signals to the spinal cord, which activates the defecation reflex. Then this reflex involves the coordination of the nervous system, muscles, and hormones. Step 3 is relaxation of the internal anal sphincter. So the internal anal sphincter, which is of course a smooth muscle, relaxes in response to the defecation reflex, and this allows feces to move into the anal canal. Then at this stage, someone will now start to feel the urge to defecate. But since at this stage, they will just feel the urge to defecate now. So at least someone will be conscious to say now they have that urge to urinate, the urge to defecate. So what is going to make them have that urge to defecate? Okay, then the fourth step is contraction of the external anal sphincters. So the external anal sphincters, which are voluntary muscles, contracts to control the passage of feces. Then this muscle can be consciously relaxed to allow defecation. So meaning if someone after step 2, on step 3, after the relaxation of the smooth muscles, then someone feels the urge to defecate. If they want, they can go there and then for a voluntary defecation, which is under step 4, or they can even wait until they reach a certain stage. Okay, so that's under step 4, where now you consciously allow defecation as step 4. Then, if you haven't consciously allowed just after you have consciously allowed the contraction of the external sphincter muscle, the next thing which is going to follow is increased intra-abdominal pressure. So the diaphragm and the abdominal muscles contract, increasing intra-abdominal pressure. So this helps push the feces into the anal canal. Then lastly, the defecation, which happens due to a combination of defecation reflex, relaxation of the internal anal sphincter, and increased intra-abdominal pressure, leads to the passage of feces out of the body. So that's the physiology of defecation reflex. Then lastly on the station 8 is the tooth. So the tooth as the crown and as the root. Then on the crown there is the enamel, you have the dentine, then you have the pulp cavity, you have the neck, then you have the gum. Okay, then you have the cement, you have the dentine is still goes from the crown to the root. Then these are the blood vessels and the nerves. So this definitely you need to know, and also need to add other well structured questions. Then station 9, where you match the following questions. So under station 9, this is about the endocrine system. So number 1 is anterior lobe of the pituitary gland, 2 posterior lobe of the pituitary gland, 3 thyroid gland. So in short, you need to match these with the column. So if this is column 1, this is column 2, you need to match them. Okay, pancreas, pineal glands, the prolactin, glucagon, calcitonin, melatonin, cortisol, thymosin. So let's answering this matching question. So number 1, the pineal gland. Pineal gland produces melatonin. Number 2, the parathyroid gland produces parathyroid. Then number 6, which is the adrenal medulla, produces epinephrine. The number 5, the adrenal cortex, produces cortisol. The number 1, which is the anterior lobe of the pituitary gland, produces prolactin. The number 2, the posterior lobe of the pituitary gland, produces vasopressin. Then the thyroid gland produces calcitonin. Then finally the pancreas produces glucagon. Then you have answered this station. Okay, so let's make progress. The last station, which is saying describe the physiology of micturition. So for the physiology of micturition, it has similar steps with the physiology of defecation reflex. So step number 1 is feeding of the urinary bladder. So the urinary bladder stores urine from the kidneys. As the bladder fills, stretch receptors in the bladder wall are activated. Then step 2, which is activation of the micturition reflex. So the stretch receptors, after of course they are activated, they send signals to the spinal cord, which activates the micturition reflex. Then this reflex involves the coordination of the nervous system, the muscles, and hormones. So step 3 is relaxation of the internal urethral sphincter, which is a smooth muscle, and it relaxes in response to the micturition reflex, and it allows urine to flow into the urethra. Then step 4 is contraction of the detrusor muscle. So the detrusor muscle is a smooth muscle in the bladder wall, which contracts to increase the pressure inside the bladder and push the urine out. Then step 5 is the relaxation of the external urethral sphincter. So the external urethral sphincter, which is the voluntary muscle, relaxes to allow urine to flow out of the body. So under the enucleation reflex on step number 3, this is also where you also feel the urge to urinate. But after you feel the urge to urinate, you can even hold on as you do the relaxation of the external urethral sphincter. But if you continue to hold on the urine for a long period of time, of course you'll be actually be receiving signals every now and then, and if the bladder or if the pressure in the bladder increases, some urine might even start to you actually start feeling pain. But of course in children this reflex is not well defined, and that's why they can just pee after holding urine for a long period of time, or if some don't even hold urine, okay, just comes out. Okay, then last step, which is now the menstruation step. So the menstruation is just a combination of menstruation reflex, relaxation of the internal urethral sphincter, contraction of the detrusor muscle, and the relaxation of the external urethral sphincter, which leads to the passage of urine outside the body. So that's the end of the OSCE station, or the OSCE quiz. If you haven't subscribed, please subscribe and hit the bell notification, and watch out for the OSCE stations now for more of a revision for exams, for the OSCE exams in anatomy and physiology. Okay, so see you on the next tutorial. If you haven't subscribed, please subscribe and hit the bell notification, and check out other videos on the channel as well. And you can go and even check out the anatomy and human anatomy and physiology playlist, and of course other videos as well.